Well, we begin with the vaccine mandate for New York healthcare workers as it's going into effect, and hospitals even fearing massive staff shortages at the same time. All of this happening as PFIZER booster shots have begun rolling out after the CDC signed off on a third shot for millions of Americans. Stephanie Ramos is outside a Brooklyn hospital with the latest.
This morning, with a deadline just hours away for all New York State healthcare workers to get vaccinated, officials taking drastic action to prepare for mass firings and staff shortages. The governor prepared to bring in out-of-state workers, even the National Guard, to help. An estimated 72,000 hospital workers are not vaccinated. Nurse Tricia Sebastian is one of them.
We're trying to do what is at the best interest for our families. The majority of the nurses that I have spoken to that remain unvaccinated are sticking to their guns.
This comes just days after a federal judge temporarily blocked New York City public schools from implementing a similar vaccine mandate for teachers and staff. Teacher Asia Levystone says she is not getting the shot and is prepared if the ruling is reversed.
I'm going to be terminated. It's going to be my last day.
In Massachusetts, the State Police Association said dozens of troopers are leaving their jobs after a judge denied a request to delay the state's vaccine mandate. Meanwhile, millions of Americans are rolling up their sleeves, receiving a third PFIZER shot after the CDC gave the green light for those 18 and older who have an underlying condition, as well as anyone 65 and older, along with frontline workers like nurses and police officers.
I'm really grateful to have the opportunity to get the booster.
PFIZER says it is now just days away from delivering their data to the FDA, arguing for the use of their vaccine on children who are 5 to 11 years old.
If they approve it, we will be ready with our manufacturing to provide this new formulation of the vaccine. It is almost not almost, it's 1/3 of the dose that we are giving to the rest of the population.
That PFIZER CEO also says it is possible to provide both the COVID booster shots as well as doses for people who have not yet been vaccinated. Kira.
Stephanie Ramos, thank you so much. All right, let's bring in Dr. Alok Patel, physician at Stanford Children's Health, for more on this coronavirus emergency. Dr. Patel, always great to have you with us, parsing through all of this. Let's talk about the mandate. And as it goes into effect now, there are still about 72,000 people holding out. As Stephanie mentioned, the governor is now talking about even bringing in healthcare workers from other states or even the National Guard in anticipation of the staffing shortage. So what do you expect to come from this, and what does it say about whether these vaccine mandates can actually work?
Well, Kira, by and large, I do think that there's still going to be some people who just resist and say that we're not going to get the vaccine no matter what, and are prepared to lose their job because of it. And it's unfortunate because if anyone has seen the horrific effects that COVID-19 has had on the population, and now with unvaccinated individuals, it's people working in the hospital. But one thing that I want everyone out there to understand is that when we're looking at healthcare professionals, that represents a whole huge group of people working in hospitals, a large demographic, which in many ways is representative of the country at a whole. When I look at my physician colleagues, over 90% of them have gotten the vaccine. The vast majority of nurses and nurse practitioners I know have gotten them as well. And so, you know, it's a false signal when people look at these protests and say, oh, look, healthcare professionals aren't getting the vaccine. That means we don't have to either, because this still represents a minority of people. I think some people will get it because of the mandate, but unfortunately, we will lose some essential workers because of this.
Which is a shame. And meanwhile, a federal judge has temporarily blocked New York City public schools from implementing a similar vaccine mandate for teachers and staff. So how will this impact the spread of COVID in New York City classrooms, you think?
Well, fortunately, above 80%, I believe, of people working in that school district, these are teachers, have gotten the vaccine. And New York has a very high rate of vaccine-acquired immunity. And also, there is some natural immunity in New York City as well, which we can't discount. But I do worry that, you know, with the federal judge blocking the vaccine mandate, all it takes is one teacher, one staff member to potentially infect an entire classroom of kids who are not eligible for the vaccine. And that's something that's very scary to think about, that it just takes one person. We've seen this case happen multiple times. So I do hope that, you know, let's say that teachers aren't vaccinated. I hope that they're at least using the other methods of layered protection, ventilation, masks, distancing, the things that we've been using for a year and a half until they make the right choice and go out and get vaccinated.
So the Pfizer booster shot, as we've been talking about, is available for people ages 65 and up. This was the big news last week. And those with underlying conditions, also healthcare workers. What's your message to those eligible? And what do you think about this and what it means for boosters for people who don't fall into those categories?
Well, Kira, there's been so much confusion about the booster shots since, I'm tempted to say since May, but especially over this weekend. My message for anyone out there who is eligible is if you haven't already gone out and gotten the booster shot, the reason that you are eligible is because you are falling into a high-risk category, either because of an underlying medical condition or because you're someone like me who's working in a hospital and still seeing COVID-positive patients. Look, I'm still wearing my scrubs from the hospital last night. These are going to go in the washing machine right after this hit. But there's a reason why we're eligible, because we have to do our best to protect ourselves. For people who are not eligible and are waiting, that decision should come out very soon. But if you aren't sure about where you fall, the most important thing you can do is talk to your healthcare professional about it and figure out what the best path is for you.
But even if you don't get the booster, you still are very well protected, right?
I'm so glad you said that. And you know, that's an important unified thread that has been maintained this entire year through all the confusion. And that's something that everyone needs to understand is if you don't get a booster shot, all the data still shows that you have an incredibly high protection against severe hospitalization or death, which is what matters, which is what the vaccine was created for. So even though there has been a little bit of distress sowed because of the conversations last week, one thing has not changed, and that's the vaccine will still keep you out of the ICU.
Okay. And as you know, Pfizer's CEO was out there today doing interviews saying that his company is just days away from delivering its data to the FDA for emergency authorization for kids ages 5 to 11 for them to get the vaccine. If approved, what could that rollout look like for these kids? And are you concerned about side effects?
You know, if approved, this could actually be a game changer in terms of keeping kids in the classroom. And the timing couldn't be more critical. So, Kira, if the data comes in a few days and we potentially, I mean, there's going to be a lot of data. It's going to take the FDA several weeks. And we see a rollout by around Halloween, which is what was predicted, we could potentially have these kids age 5 to 11 protected until when winter comes around. So cold flu season, but also colder weather. People are going to be going indoors, which is when kids need even more protection. We're seeing the Delta variant basically shuffle around the country, going to unvaccinated populations, and it's absolutely targeting kids, with 26% of new cases being in kids. And when it comes to side effects, a lot of people, including myself, including parents, are paying close attention to see more data, which the FDA will hopefully release and we'll get report of. Because last week, all we saw was that, you know, we saw the anecdote that it didn't produce a lot of adverse side effects according to the press release, and it gave a really good antibody response. But we need to see more data. We have to be evidence-based when it comes to supporting this vaccine, and that is our intention.
Dr. Alok Patel, great seeing you today. Thanks so much, Doc.
Likewise. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.